Hello, hello, Stephanie, your mama mentor here, back for another little technique to help bust your anxiety from the book, The 10 Best Anxiety Busters by Dr. Margaret Warenberg. Book looks like this, and let's get started. This one is simple, breathing. Not just any kind of breathing, diaphragmatic breathing, okay? And she describes it in her book, and so I'm gonna read straight from the book so you can get exactly her words on the subject. But I do recommend, I highly recommend, and I do this with all of my patients in psych as well, that you have a breathing technique that is built into your day. That's a habit for you. It's super important. You have to learn how to breathe properly to control stress and anxiety in your life, or, well, things might just start falling apart, including your body. Okay, diaphragmatic breathing. Taking just one deep breath and letting it go will help relieve some stress. But breathing to control anxiety works better if you do a method called diaphragmatic breathing. Practice the first time by lying down or standing. After that, you can breathe anywhere without anyone noticing. Remember, the goal is not to change the way you breathe as you go about your daily activities, but rather to consciously change the way you breathe when you begin to feel panic or anxiety coming on. Here's how to do it. Number 1, lie down flat on your back or stand in a relaxed manner, feet slightly apart, knees loose. This is so you can sense the movement in your abdomen, which should move out when you inhale and pull in when you exhale. Number 2, rest your hand on your abdomen. This will help you notice if you are breathing deeply enough and whether your chest is tight. Number 3, next, exhale the air in your lungs so they are completely empty. Number 4, then breathe in evenly through your nose. Fill your lungs from bottom to top in equal, even amounts. Imagine how a balloon fills with water when you attach it to a faucet. The bottom fills and widens first, and then the water expands the upper portion. The air should go into your lungs in the same way. Again, make sure the inhalation is slow and even. It may help to count until you feel exactly full. A slow 1, 2, 3, 4. You'll probably take 3 to 6 counts to fill completely. If you don't like the idea of counting, breathe while thinking a sentence with an even rhythm, such as, I am steadily filling my lungs with air. I am emptying my lungs slowly and evenly. Number 5, exhale evenly, taking longer than you did to inhale, at a slow pace until your lungs feel empty. Imagine you are blowing out the flame of a candle enough to move it, but not blow it out. Number 6, if you get dizzy, exhale for 2 counts exhale for 2 counts longer, or pause for 2 counts at the end of the exhalation of your breath before you start to inhale again. Number 7, continue the slow, even inhalation and exhalation for about a minute, but over time, gradually increase the breathing practices to 5 minutes. And practice. Practice, practice, practice. Now, I will add to this from another book that I read recently. I did learn that it is super important that your diaphragm is expanding equally on both sides. So to test this, you can lie on your back, put your hands at the lowest part of your rib cage so that your hands are right at the bottom there of your ribs, and then slowly breathe in through your nose and see if your hands are rising equally on both sides. For some people, one side rises more than the other when you breathe in, and this can be a problem with your vagus nerve if that's the case. It can mean that your vagus nerve needs a reset. And I will talk about resetting your vagus nerve in another video, but it is important to know that sometimes the vagus nerve needs a little help, and there is an easy enough way to do it, and that is the way you can tell if it needs a reset. I'll talk to you soon. I hope this was helpful. Mwah.